Welcome to our journey inside the body, where we'll meet a tiny enemy that can have a big impact: hepatitis C virus, or HCV. Let's explore how it enters, how it affects the liver, and most importantly, how we can fight back and protect our health. Once upon a time, a tiny enemy called hepatitis C virus entered the human body, or HCV. It's a viral infection caused by a small, enveloped, single-stranded RNA virus. HCV mainly affects the liver, causing inflammation that may become chronic. HCV doesn't just walk in through the front door. It sneaks in when someone gets a blood transfusion without proper screening, or uses contaminated needles or syringes. It may even pass from a mother to her baby during childbirth, or through organ transplants. Sometimes it spreads through sexual contact, especially if there are wounds or bleeding. Once inside the bloodstream, the virus travels directly to the liver, its target. It enters liver cells, called hepatocytes, and begins to multiply. The immune system sees the invasion and reacts, but instead of killing the virus, it causes long-term inflammation. This chronic inflammation damages liver cells and may lead to serious diseases like cirrhosis or liver cancer. But how does the body feel this attack? At first, many people feel nothing, but over time, HCV may cause symptoms like fatigue, anorexia, abdominal pain, jaundice, that's yellowing of the skin and eyes, dark-colored urine, and joint pain. Doctors have tools to catch this virus. First, they look for anti-HCV antibodies using ELISA or rapid tests. If these antibodies are found, they follow up with a PCR test to check for the virus's RNA. Liver function tests, like ALT and AST, show whether the liver is damaged. But here's the good news: HCV can be treated. The main weapons are direct-acting antivirals, or DAAs. They're taken orally, work quickly, and are well tolerated. DAAs cure HCV in 8 to 12 weeks for most patients, and they come with fewer side effects than older treatments like interferon. So, how do we stop HCV from spreading? By screening all blood donations, sterilizing medical tools, and using safe injection practices. Also, avoid sharing razors or toothbrushes. Raising awareness about HCV helps prevent infections and saves lives. Hepatitis C is a serious disease, but it can be prevented and even cured. With awareness, early diagnosis, and effective treatment, we can defeat this hidden enemy. Let's work together to protect our livers and our lives.